You're responding code 4 to a 50-year-old female who's suffering from chest pain.
Suffering from chest pain? Okay. So I'm walking, we're pulling up our stretcher all the way to the house. Do I see the patient outside, inside?
So you notice that the patient is located outside of her residence. Looks like they are moving today.
Okay.
Couple of boxes are around. You see a moving truck. You see the patient is positioned on a lounge chair
Right.
on the front porch, about 2 or 3 steps, and is currently gripping onto her chest like so.
Okay, so I'm walking to my environment. We are outside, so I do see a bunch of boxes around, and I do see the patient there as well. So I don't see anything that's going to affect our care. There's a full 360 available around us to go around. There's one, there's neck injury. We heard from dispatch that it is, she is suffering with chest pain, and she looks like she's short of breath right now. One casualty, Allied Resources. Don't think we need it right now, but we'll call them later if we need to. And I would go ahead with full PPE because she is short of breath, which is a symptom of COVID, so we're gonna go ahead. So as walking to the patient, I'm looking at the patient. Do I see any obvious bleeds or any diaphoresis on her face?
So the patient does appear to be quite diaphoretic. Does look like she's been spending some time outside today. It is about 30 degrees outside.
30 degrees, okay.
Yeah.
Okay, so hi there, my name is Darcy. This is Logan, we're paramedic students. Is it okay to help you?
Yes. Strong regular pulse.
Okay, perfect. Can you tell me what's happening? Can you get a set of vitals, please? And then we'll get a two as well.
Just having some chest pain and it's hard to breathe.
You're having some chest pain and hard to breathe? Okay, so she's talking to me clearly. So her airway is open. Her breathing, she does look like she's taking deep breaths. I do see some accessory muscle use being as well. Circulation, I just want to confirm her circulation is strong and regular?
Yeah.
Okay, perfect. So you're having trouble breathing?
A little bit.
Okay, can you tell me what you were doing before you were doing that? Before you started experiencing this, sorry?
We're moving, so I was just packing the moving truck with the boxes.
Oh, with the boxes. Okay. Has this ever happened to you before? Yeah? When did it happen to you?
Maybe 2 years ago.
2 years ago, okay.
Went to the doctors.
To the doctors, okay. Do you take any medications or anything that we should know about?
I have some medications for high blood pressure.
High blood pressure?
And he gave me a spray.
Okay.
For my
A spray for your chest, okay. Do you have any other medical conditions that we should know about?
and something called angina.
Okay,
And
angina.
high blood pressure.
High blood pressure. Okay. So your name is Riley, right? Okay, so Riley, we're just going to we're definitely
here, okay?
we're gonna help you out here, okay? So she's just gonna do some vitals. Right now, I just want to make sure everything else is okay. Is it okay if I do a quick one over just to see if anything is? Okay. Do you feel comfortable in this position, or are you okay leaning back a bit?
My breathing.
It's okay.
Can you just relax your arm here for a sec? Thank you.
Okay, so I'm just going to, what I'm looking for is, I'm just looking, so she is diaphoretic. Do I see redness? Is she pale?
So she does appear to be quite red. Unfortunately, there's no family around to confirm that.
Okay.
Yes.
Okay. So Riley, is it okay if you lean back for a second? I just want to check something on your neck. I know you're experiencing some chest pain. So while I'm looking at her neck, can you look over there? Do I see any JVD?
No evidence of JVD, no.
No evidence of JVD. Okay. So I'm just going to get you to take a deep breath in. Yeah. Okay. Everything's good. Looking for any deadly bleeds or anything like that. I don't see anything.
Blood pressure is 160/90.
160/90.
Just gonna put this on your
Okay,
finger.
perfect.
Okay.
Okay, and does she have any peripheral edema?
No peripheral edema.
Okay.
Circulation's normal to the feet.
Okay. So sorry, I don't know if I said that we can get it to read as well after vitals. Thank you. So you're telling me, how does the pain feel? You said
It's like heavy.
it's a heavy pain.
It's like pressure.
Okay. And you said it started right after you were lifting some boxes when moving. Okay. And is there anything that's making it worse? Like when you were lying down there, did it make it worse? Did it make it better?
Not really. No, just the same.
But you feel more comfortable doing it in this position,
It helps
right?
my breathe.
Okay. And does the pain move anywhere? Like, is it moving anywhere? Or is it just in that one spot?
My shoulder's a little sore, but I don't know if that's just from lifting. Or
Okay.
if it's related.
Okay. And on a scale of 1 to 10, how bad would you describe this pain? 10 being like
Just
the
a
very
couple
worst.
sticky hairs, Riley, okay?
Maybe like an 8.
An 8? Okay. Okay, so Riley, what I'm going to do now is I'm going to, because I know you do have a history of angina and you said high cholesterol. And your medications, do you know the list of the medications that you take? Because you said nitro, but do you take any other medications?
It starts with an Metro something like
Okay,
that.
yes,
Then Astro.
Atorvastatin?
Yeah,
Okay,
that
okay.
one.
Sure. And did you take your nitro, your red bottle here?
No, it's in the bathroom.
It's in the bathroom.
Just gonna take a
Okay.
look into the lungs just to make sure.
So what I'm going to do here is I'm going to give you
Deep breaths
something
in, Riley, okay?
to hopefully make this pain feel a little bit better. We are probably going to give you nitro in a bit. We just want to confirm something with the little monitor that's going to take a picture of your heart, okay? So I'm deciding to give her aspirin. I'll give her 2 tablets, which is 162
Sounds
mg. Can you please confirm that this is aspirin?
Yep, aspirin, not expired, 162.
Okay, perfect. So I just want to quickly go through the conditions and contraindications. So I do suspect this is cardiac ischemia, which is why I want to give her aspirin. The contraindications. So are you asthmatic at all, Riley?
Not I know.
No. Okay. And do you have any other allergies that I need to know about? Okay. So she's not asthmatic. She has no allergies. And do you have any active bleeding? I know it's a funny question. Like any blood in your stool or anything? No. Okay. And then have you had a stroke in the last few days at all? Nothing? Okay. So I believe that she is indicated for aspirin. I will be giving it orally, and she will be chewing it into a paste before swallowing it. So Riley, have you ever taken aspirin before?
No.
No? Okay. So what I'm going to do here is that I'm going to get you to chew this into a little paste. Okay, it might taste a little funky, but once it gets into that paste, I want you to swallow it, okay? Are you okay with doing that?
Yeah.
Okay, so I'm giving it to Riley. It's oral. I confirmed with my partner about the expiry date and the dose, which is 162. So you can go ahead and chew this. Let me know if you have any other questions or anything, okay? Okay, so she's chewing it.
O2's at 96%, rest rate is 12 deep and regular, and heart rate is 120 regular.
Okay. So 214 is when she took her medication.
Okay, awesome.
So you said, sorry, heart rate is
120 regular.
120 regular, rest rate is,
12 regular and deep,
okay,
and oxygen's at 96%.
96%. Okay. So we got our 2 lead. Do we have any?
Let's look.
Come back.
Looks.
This is your 2 week.
Okay, so
Alright.
I believe that's sinus.
Sinus
It looks
tacky.
tacky to me. Does it look tacky to you as well?
Yeah.
Okay, so sinus tacky. Can you go ahead and get a 12 lead on her
Yes.
to see if we can get her nitro or anything? Thank you so much. All right, Riley. Is there anyone else that was helping you move or anything? No. Okay. And you said it was happening for moving, for like when you were just lifting boxes and stuff. Okay. When you took the aspirin, is it making any difference for you right now, or
It feels the same.
it feels the same? Okay. Do you feel comfortable in that position? Like we can get you on this stretcher or anything right now?
I'm comfortable.
You're comfortable for now? Okay. So we're just gonna take a picture of your heart, right? Okay, just to make sure,
You're just gonna have to go under your shirt here, okay?
Okay.
Alright.
just to make sure that it's not anything worse than your angina here, okay? And when's the last time you've been to the doctors?
Maybe like 4 or 5 months ago.
5 months ago, okay. And that's when he prescribed you this medication?
No, he was just doing a checkup.
A
All
daily
right,
checkup?
Riley, sit still and just take some deep breaths for us, okay? Awesome. Alrighty, let's go ahead and look.
Okay, so this is the 12 lead. Okay. Oh. Okay. I do not see any ST elevation. Do you see
Nope.
any?
No,
Okay. So I think it's a non-STEMI.
non-semi can definitely rule out right-sided.
Yeah,
for
we can
sure.
definitely rule out right-sided. Okay.
Just to clarify for the camera, the 2 lead red sinus tachycardia
Yes.
and the 12 lead did not resemble a STEMI.
All
No.
right. Okay, so perfect. So Riley, so yeah, the picture confirmed that you're doing okay, so that we are able to actually give you.
Feel okay.
I know, but I mean, like your heart's doing fairly okay. We're gonna give this to you, so hopefully it'll make you feel better. Okay, you do know, like, this is something that looks familiar to you. Okay, so this is nitro. So I'm going to give you 0.4 milligrams. So how it's gonna work, just to reiterate, I'm sure you know, is I'm gonna get you to lift your tongue, I'm gonna do a little spray, and then you're just gonna close it back up, okay? So nitro 0.4, and
I mean, just take a quick blood pressure right before we
Doesn't
do
look
that,
expired.
just to double check it.
sure,
And I'll double check it for you.
if you wanted to confirm that.
Nitroglycerin, awesome, doesn't look expired. How much do you want to administer to patient?
I would do 1 spray, and I'll do a max of 6 doses
Awesome.
every 5 minutes.
At 0.4 milligrams?
Yeah, 0.4
Awesome. Sounds
mgs.
good.
Yep.
I'll go ahead and get the stretcher ready so we
Okay,
can get ready
perfect.
to
So blood pressure is good?
go. Same, still 160.
Okay, 160. Okay. Okay, so Riley, I'm just gonna get you to open up your mouth, and then I'm gonna do a little spray. Okay, so remember, anytime you feel any worse, just let me know, okay? So I'm just gonna do it. We're gonna go ahead and prime that first. Okay, okay, and go ahead. All right, so it is 217 of when she got nitro for documentation. So do you have the stretcher ready for us?
Yes.
All right, Riley, we're gonna take you to the hospital, okay? The medication should help you feel a little bit better, but I still want the doctors to get a little better check of you, okay?
Okay.
Do you feel okay with standing up, or do you feel okay with standing up?
Yeah.
Okay.
Okay, let's just lower it quickly.
Okay, sure. Do you think that she should stand up, or should we
We'll
just pour it
just
up?
scoot her. We'll get it as close
Okay.
to her as we can,
Yeah.
so we can just scoot her over so she doesn't exacerbate it again.
Okay, let's go.
Okay, ready?